Hello, hello. Hi everyone, this is Charlotte and J. Roth as well. Just doing a quick pop-up Q&A for my cancer conquerors out there so we can do a recap of this week's subject, alkaline versus acidic balance. So come on in, happy Friday to you guys. I am excited to do this recap and let you guys know um, what we've been talking about all week long in terms of the alkaline acidic balance and how important, how key that is for cancer conquerors to really know about, for their bodies and so that they can move forward and thrive. And so what we talked about during the week was we identified some acidic foods and I gave you guys a challenge. I said, try it for a week. Try cutting out these acidic foods and then try adding in some alkaline foods to see how your body feels. You know what? At any rate, I can tell you everything all day long, but the real gauge is if you know your body. And this is a way to help you try and know your body better, how your body feels, what your body is saying to you. So the alkaline acidic balance really stems from two things. If you have questions, feel free to post your questions in, and I will be sure to answer them as soon as the broadcast is over. Post your questions. But yeah, I wanted to talk about the acidic balance. So one of the things you want to talk about, you want to know as a cancer conqueror is that your pH balance in your body as a cancer conqueror is key. I mean, if your pH balance is too acidic, your body is now a breeding ground of inflammation. Inflammation, left unchecked, is it's a breeding ground for sickness, disease, whether it's cancer, diabetes, high blood pressure, lupus, AIDS. Everything stems from the acidity level in your body. So this is why for cancer conquerors, it is so important that we pay attention to the acid level in our body. Doesn't mean we need to monitor it every day. If you have live tumors, you do need to monitor it quite often so that you can stay on top of what your acidic level is in your body. And so when we talk about the acidic level, what does that mean, Charlotte? Yes, happy Friday, you guys. What does that mean, acidic level? It means that based on the foods that you eat, your body, and things that you drink, it actually creates either your body to be more acidic, meaning that the pH balance in your body should be right around the sweet spot, as they call it, should be right around 7.3435 to 7.45. How do I do that? How do I monitor my pH balance? I mean, you can buy pH strips and test your urine first thing in the morning. For cancer conquerors, if you have live tumors, you should be testing your own pH level so that you can know what is the alkaline acidic level in your body. I do it often, but not as often as I used to do it because I know based on what I'm eating, what I'm drinking, that my body is not overly acidic. And so that's why I wanted to mention to you the pH level is key. And when our bodies fall below, say like the 7.35, then our bodies are leaning towards more acid. Now, here's the thing to keep in mind. In order to break down food, our bodies does need acid in our gut in order to break it down so that we can pass it through. So that's important. You have to have some acid in your gut. However, we're talking about acid in the gut as it relates to, and in addition, acid in the gut, but not acid all over your entire body, which means that your body is now more acidic than it is alkaline. And so when your body is more acidic, you're more prone to, you will feel it. You'll feel like the inflammation. You'll feel like stiffness. You'll feel like tightness in your joints. You'll feel like even things in your body. You'll feel it in your body. And this is one thing that you have to pay attention to. That's why I said it's so important for people to know what their body is going through. You have to know how your body feels with what you're doing or what you're not doing in terms of the alkaline acidic balance. And so that's key to know what your acidity level is. And yes, you can buy pH strips from Amazon, your local drugstore, whatever is convenient for you, and test your pH level, because that's going to be key for you to know as a cancer conqueror. And one of the reasons why we emphasize the balance for cancer conquerors is because if your body is more acidic, as a cancer conqueror, you are more prone to really develop tumors. You're more prone because your body's the atmosphere in your body is really like the perfect storm because it's more acidic than it is alkaline. Is it easy to get your body more alkaline? It takes a bit, but yeah, it's not that difficult. You just have to shift in what you're eating. If you start to increase foods that are more alkaline, foods that will actually make your body more alkaline, it's not that difficult to have the balance in your body of the food. So telling me I can't rotate my phone while I'm recording. Okay. So anyway, what I was saying is that the balance in your body, the alkaline acidic balance in your body is key to know. And so I wanted to come on, take some questions just to see, how you guys are feeling in terms of some of the things that we talked about this week, which relates to cancer conquerors and the acidic alkaline balance in our bodies, and how important that is for us moving forward so that we can really thrive in our bodies, in our environment, and in our mindset. And so another thing I wanted to add was we talked about alkaline foods. We talked about those foods that you can introduce to your body that will make your body more alkaline. And like I said, there is a sweet spot in terms of the pH level in our bodies because, normally our bodies help us to control the acid-alkaline balance. It really does. And it's done through our respiratory system, our urinary tract. However, we still need to monitor it as cancer conquerors because the pH level is going to tell you whether or not you need to shift your diet. It's going to tell you whether or not you're too far left or too far right. Now, I will say that you can be too alkaline as well. Your body can be too alkaline, meaning that what you're doing is good. However, you need to have a little bit more acid in your body in order to be able to balance it out. You don't want it to be too far left or too far right. So some of the foods that we mentioned in this week, some of the foods that we mentioned, that were more acidic than alkaline included a lot of your dairy products. I mean, your buttermilk, your pastas, and even the things that turn into sugar. Table sugar, brown sugar, white sugar, all of these things, pasta, cheeses, certain milks, buttermilk, and certain meats, red meat, pork. All of these things are more acidic in nature. Black tea, certain chocolates are more acidic. Artificial sweeteners are just notorious for making your body more, not only just more acidic, but now you're introducing something that is artificial. So these are the foods that we talked about this week that were more acidic. You want to be sure that you try to limit your intake of these acidic foods. Why? Because you want your body to be more balanced. You want your body to be more alkaline than it is acidic. And like we talked about, there is a sweet spot balance to that. Now let's talk about some of the foods that you can introduce into your body that are more alkaline. And like I said, this is not a hard thing. I mean, just shifting some things, and what we call it is crowding out. If you start to introduce some things into your system, especially when it concerns alkaline and acidic levels, you will notice that you won't even want some of the other things that are more acid forming. So some of the foods that we talked about that were more alkaline is your spinaches, your broccoli, your avocado, green tea. These are things that I eat all the time. Celery, let's see, sweet potatoes, pears, pineapple. These are more alkaline based. Asparagus, I mean, there's a whole bunch that you can that you can introduce to your diet that are more alkaline. And when we balance them out, our body now has a good supply of both so that we are pretty much more alkaline than we are acidic. Why is that important for cancer conquerors? Because when our bodies is too much acid in our bodies, the pH level is too acidic, then our bodies become full of inflammation. Inflammation is a breeding ground for cancer, any other sickness, any other disease you can say, diabetes, I mean the whole gamut. We have to stay on top of our acid-forming foods and acidity level in our bodies. How do we do that? We just shift some things in our diet, and you will be surprised how much, not only you notice a difference, but how much you will feel much better. And for cancer conquerors, it is important because I know it's in the back of your mind sometimes, and here's where the mindset comes in. We talked about mindset last week. Mindset is important for cancer conquerors because what you're thinking has the ability and the power to really shift your mindset from positive or negative. What you're thinking about constantly, what you're letting your mind stay, concentrated on, it affects your overall health. And this is for other people too. I mean, if you are someone that, you eat great, but you hate your job, guess what? It's affecting your health. If you are stressed out continually, it's affecting your health. If your diet is not so great, it's affecting your health. And like we're talking about, the acid and the alkaline balance, you have to be willing to take some ownership of your own body and do what your body needs. Doesn't mean that, you have to, nobody's perfect, so it's not about being perfect. It's about helping your body do what it naturally can do on its own. And your body has the ability to naturally heal itself. That's a beautiful thing. We don't have to do a lot of extra things. However, our bodies need the right ingredients, the right substances, the right things in order to be able to stay and remain healthy. So if you have any questions, let me know, post them for me. But I just wanted to come on and, just talk to you guys a little bit about how important it is for cancer conquerors to really be mindful of the things that we are doing to keep our alkaline acidic level in balance. And again, the sweet spot for that is about 7.35 to 7.45. How do we monitor that? Just doing a quick recap. How do we monitor that? You can purchase pH strips from Amazon, from your pharmacy, from wherever you can buy products. But just Google them. I mean, you can buy pH strips and test your urine first thing in the morning. And it usually gives you like a gauge on there, so it'll tell you exactly where your pH level or your acidity alkaline level is in your body, so that you will know exactly how you need to gauge your diet, how you need to gauge what you're drinking. I mean, yes, you can incorporate alkaline water. That's great. You just want to be careful that you don't do too much. Hi, Tequila. How are you? Good to see you. But yeah, you need to make sure that your alkaline acidic level is in that sweet spot. It is sometimes a little difficult to keep it in that sweet spot if you just are checking it like 1 week and you're not thinking about it for 3 weeks on end. If you are prone to any kind of disease, any kind of sickness, you need to be careful of what your alkaline acidic level is in your body. How can this help our cancer conquerors? It's critical, because if we can control the acidity level in our body, guess what? Hi, Valerie. Nice to see you. If we can control the pH level in our bodies, the acid level and the alkaline balance in our bodies, cancer doesn't have a chance to breathe. I mean, I know this is a hard concept sometimes for people to grasp because, all we've been fed in this country is conventional medicine. And I'm not knocking conventional medicine, but there's a whole holistic side that, guess what, has the ability to heal your body naturally. It's based on some of the foods that we're eating. So if we're filling our diets with, you know, hi beautiful, how are you? Good to see you. Yeah, we're filling our bodies with like vinegar. And if you guys have questions, feel free to ask me your questions. Just post them in and we will take care of them. Because we're talking to cancer conquerors today about how the alkaline acidic balance is so important and critical for them in order to be able to stay on top of whatever is going on in their body, whether it's dealing with their, you know, how their ability to really come back and bounce back from the things that are challenging to them. And we talked about these. Hi, Charlene. Good to see you again. Yeah, we talked about these things. We talked about your dairy products. A lot of your dairy products have way too many antibiotics. And it just, if you knew, I mean, I don't want to go into detail because we're talking about alkaline acidic balance, but dairy products fall in the category of being able to now keep the acidic level high. So Tequila has a question. She says, how do you maintain this daily? I talked about it earlier. You want to maintain your pH balance in your body. How do you do that? There are pH strips that you can purchase, and you test your urine in the morning. The first urine of the day, you want to use the pH strip, put it in the stream, and I'm telling you, you'll know. And they usually have a gauge on there that tells you exactly what your pH level is. Is it too alkaline? Is it too acidic? And that's how you are better able to tell where you fall at. And it's not good or bad. It's just that this gives me the information that I need to know in order to be able to redirect what I'm doing. Because your body, again, has the ability to heal itself. So we talked about a lot of the, and I hope that answers your question. And once you begin to adopt, you know, adopt the pattern, adopt the system that actually helps you to really concentrate more on balancing your foods, balancing what you're taking in and your beverages. Because a lot of coffees are, especially the coffees that are, if they're not organic or Swiss, there's like a Swiss process in order to be able to, you know, produce the coffee. These things are going to be toxic. They're going to be more acidic in addition to the pesticides that they put in it. Coffee is definitely acid forming. Valerie has a good question. She says, how do you have a list of these foods? Do you have a list of these foods? Yes. If you look at my post from this week, I put in a list of acidic foods and a list of alkaline foods. If you just take a week and begin to take out some of those acid-forming foods, see how your body feels. Start to introduce some of the alkaline foods and see how your body feels. So it's almost like a give and take. You're taking a little something away, but you're replacing it with something that's going to take your body in the right direction in terms of being more alkaline than it is acidic. And this is critical for cancer conquerors because knowing what your level is going to determine whether or not cancer stem cells have the ability to grow or not. I know full well because this is what I went through. I had to learn all of this. And I had to really study and find out what was the sweet spot, knowing how to really manage your diet. And it's not that difficult. I mean, I know diet is the most important thing. And even for cancer conquerors that, like myself, that thrive now, it does not mean that I can just, you know, live willy-nilly. No. I try and pay attention to what is in my diet. Because what you eat has the ability to determine whether or not you will have reoccurrence. I know that's a hard truth for a lot of people. However, it's true. It's tied into nutrition. And a lot of things that are going on in conventional medicine, they don't talk about that because they don't know. And I get that. I'm not knocking conventional medicine. I'm just saying that nutrition, our bodies know how to heal itself. And so, yeah, I do have certain lists of foods that are more acidic. Your dairy products, your artificial sweeteners. I mean, certain teas are more acidic. Your white bread is acidic. wheat bread is acidic. Um, a lot of your sweetened juices are acidic. Red meat is more acidic. Now, does that mean that you have to determine for you? Because everybody's body is different, but I do know that certain foods, depending on where your pH balance is at, you can either, if you're, like for me, let's say for me, for instance, my body tends to stay more alkaline because that's the types of foods that I eat. I eat mostly plants, mostly plants. I do a little fish, but it's predominantly plants, veggies, fruits, that type of thing. So that's going to automatically make your body much more alkaline than it is acidic. Does that mean I don't need some acid? No, it doesn't. It means that because you need the acid to break down the food so that you can pass it through. So sometimes I actually have to add a little bit of acid to my diet in order for it to be able to break down, because if it's not breaking down, it's staying within you. If it's staying within you, it is creating toxins in your body, and we don't want that as well. So yeah, I mean, the foods that are more alkaline, they're going to be like most of your fruits, your spinaches, your broccoli, your salmon is great, your collard greens, and it's all about how you prepare it too. One of the best things that you can do, because normally when we cook foods, foods are generally going to turn more acidic. When we eat them raw, it's going to automatically be more alkaline. So it's always good to have a balance. You don't want to be eating all cooked food, because if you're eating all cooked food, the majority of what your body is producing is an acidic state. You have to switch it up. One day do cooked, one day do raw. Now you're asking, what about fiber? Fiber is good, but it depends on the fiber that you specifically need. Fiber is good. So if you have a mostly alkaline diet, I tend to try and bulk up on fiber too, because depending on your system, and this goes back to what I was sharing about, you have to really know your body. Take some time that after you eat something, see how your body feels. If you eat a steak and your body feels like somebody just beat you up and it's sitting in feels like a piece of concrete in your gut, see how long it takes you to pass it through. These are indications that it may not be for you, or you may need to scale back in moderation of it. Sometimes it's about we need to eliminate some things altogether. But if we're not paying attention to it, then we won't know. We are the best judge of our own body. So fiber is important. Fiber, and you can get fiber from a lot of your fruits and veggies. I mean, a lot of your apples are great fiber. Pears are great fiber. These are all fibrous. I tend to, I don't do like bananas because they're way too sweet. They're not productive for me. Some people thrive from the potassium. I can get the same potassium, even if not more, from dates. I mean, I eat dates all the time, it's naturally sweet. Dates are phenomenal. I put them in my smoothies. I don't use processed sugar. If I use sugar, it's just like coconut sugar, but I don't have a desire for sugar. And that's a thing that I think sometimes would happen. But I tell you what, when I was diagnosed, I was addicted. Addicted to sugar. And it's a real thing. Sugar, the addiction to sugar is much more dangerous than the addiction to cocaine. I'll say that again. The addiction to sugar is much more detrimental to you than the addiction to cocaine. It's worse because it constantly draws you back to it. Anything that constantly draws you back to it, that's an addiction. It doesn't matter what it is. Yes. Tequila has a good question. She says, can you do a live on digestive issues? That's not my territory, digestive issues. But some of the things that I'm sharing with you today, they actually help with your digestion. So here's the thing. If you are having digestive issues, and this is just like an overall, like a broad response, but I think it's effective for you, try and do more raw. Try and do more raw plant-based as opposed to a lot of your grains, a lot of your your process. I mean, we got to stop process. The processed food is sometimes, and that doesn't mean that because you sometimes order out, you don't know how people are preparing the food. If you don't know how they're preparing it, you don't know for certain that you're getting exactly what it is that you're supposed to be, that you want. So I would say help yourself to go more raw. Do some juicing. I mean, I've posted some lives and some videos in terms of some juicing. Yeah, and try to increase. Yeah, okay, God. Yep, she's saying she wants to increase her fiber intake. Fiber intake is important because if we're not taking in enough fiber, especially for your digestive system. Here's the thing. People don't realize that, yes, we have our brain, but the number one brain is in our gut. Our gut is actually the first brain because that will signal to the brain that we know of in our head. Our gut has the capacity to really dictate. So if you don't have a good microbiome in your gut, you're going to have digestive issues. I try and lead people in terms of, even though it's not my area, I know enough about the gut because I have to maintain what's going on in my own gut. I try and stay more, for me, in terms of plant-based. I'm not totally plant-based because I do eat wild-caught fish, but only certain ones. But other than that, I don't eat meat because it's just not beneficial for me. Some people do need animal protein, and if they do need the animal protein, then I tell them, listen, you've got to do organic or grass-fed. If it is beef, please make sure it's grass-fed. If it is poultry, please make sure that it is organic, because if not, hi Tammy, good to see you. Yeah, if it's not organic or grass-fed, then you're getting too much of the antibiotics and stuff that they put into the cows. Whatever they're consuming, you're consuming. And antibiotics, the majority of antibiotics in this country do not go to humans. Pretty much upwards of 90% go to livestock. And that's the livestock that people are eating in this country. So, for digestive issues, yes. And cancer conquerors sometimes go through some types of digestive issues, especially when they're trying to shift from a lot of the process, a lot of the, the artificial stuff that's out there. So it's a good idea for you guys to really think about how your body feels. How does your body feel after you eat something? How does your body feel after you drink something? Pay attention to that and make note of it, because that's telling you something significant. Your body will tell you exactly what it needs to know when you do, and you pay attention to it. So yeah, if you guys have any more questions, let me know, because we are talking about and encouraging our cancer conquerors in terms of the alkaline acidic balance in their body. And so yeah, guys, send me your questions. And for those cancer conquerors, I just started a private Facebook group called Cancer Conquerors Who Thrive. Yes! And this is a private group, because I want to be able to share with our cancer conquerors exactly what they need to know. It's like a community, but I don't mind coming out and sharing the information with you guys as well, because I believe that everybody either knows someone or is related to someone that has gone through a cancer diagnosis. I am a cancer thriver because anybody can survive. We're here to thrive, and I can help you in your journey if you have been diagnosed, if you are open to a holistic therapies. I would be more than help you, because this is what I do with my clients. So yeah, guys, I mean, if you have any questions, let me know. If you know someone that has gone through diagnosis and they are looking to try and help now regain their body or their mindset or their environment, because all three play a key role. Overcoming and thriving from cancer is not just about what's happening in your body, it's about what's happening in your mind as well. It's about what's happening in your environment, because there are a lot of things that we're exposed to in our environment that actually help to fuel cancer cells growth. People don't always realize that, but it's true. So, If you guys have any questions, check me out at J. Rafa's Well, Holistic Health Coaching. And like I said, send your whoever you know that may be dealing with an issue. I have a program set up that I help teach my clients so that they can thrive again in their bodies, in their minds, and in their environment. So I'm so glad that you guys stayed tuned. So good to see some folks from CT on today on the live today. But yeah, guys, it's important. Remember, alkaline, acidic balance. You want your bodies to be more alkaline than you do want them to be acidic. There is a balance. How do we do that? Check out some of my posts from earlier this week. I said to introduce take out some foods that were mostly acidic, that were all acidic, and start to introduce some of the foods that are more alkaline. If you get that balance, you'll be good. Do you monitor it? Yes. pH strips. You can purchase them from Amazon or at your local pharmacy. And you test your urine strips in the morning, first thing in the morning. So yeah, guys, listen. So glad you guys were with me today. And I will talk to you next time. Have a great, great weekend. Bye.